Let's say I was going to be a patient of yours, somebody that was going to regularly see you. That first initial visit, what would I expect?
That's a good question. So usually the first visit, I've done the backhand research where I've looked at all of your doctor's notes and your lab work. So I'm pretty, up to date on what's going on with you clinically.
Yeah.
And then my job, the first appointment, is to find out what you want out of the session. So usually people come, wanting some kind of change in their life. They want to feel better. A lot of people want weight loss. In my specific work, people want to control their blood sugars, because when your blood sugar is out of control, it damages your organs and tissues. So I usually start by just talking to them and gaining rapport, kind of like we're doing now.
Okay.
Building a friendship, building trust, and then from there, I can give them tips and really help them to devise some kind of a plan that's going to get them on, the track that they want to be on.
So part of that, again, is relationship building, but it also sounds as if it's a lot of collaboration. So collaboration between you and also your customer, your client, in regards to what they want to get out of, their visits with you.
Absolutely.
Speaking of visits, I'm sure everyone is different, but that initial visit is one thing, and you've already done all that background and you're prepared to have that conversation. But what would the follow-up visits look like, or how long would somebody actually work with you to get healthy, get back on track?
Yeah, it really depends on the person. So the first visit's about an hour.
Okay.
And then the second visit's usually 30 to 45 minutes, depending. Sometimes they end up being an hour too.
Okay.
But basically, the second visit, the first visit, I'm giving them a lot of goals. So, or actually, as you said, we're collaborating to create a plan. So we usually have some goals that we're going to follow up on at the follow-up. And I see how they're doing. And typically, especially if they've just started implementing these things, there's going to be some stumbling blocks. So that's where I come in and help them to revise the plan and to add new things to the plan.
Okay. Let's talk about resources. What are some available resources, whether in the community and the work that you're doing with your clients, and also possibly for schools?
For just learning about nutrition?
Yeah.
Well, the government website has a good, Michelle Obama created the plate method.
Okay.
So I go on that quite often. And also Harvard Nutrition has a lot of good resources as well.
Okay.
So typically I will refer people to those types of websites. Depending on, with nutrition, it really just depends on what you're looking for. So if it's like a kidney issue, I would relate them to DaVita.
Okay.
DaVita is like a well-known kidney resource. And also if it's a heart issue, it would be American Heart Association. So it really just depends on what they're looking for to learn more about.